Today's video diary from the World Health Summit 2010 is brought to you by the Faculty of Medicine, Nursing and Health Sciences at Monash University.
Hello and welcome back to Berlin and to the Charité campus here in the Mitte district for day 4, the final day of the World Health Summit for 2010. And whilst it's the final day of the summit, there's been no let up for the Monash delegation. The day kicked off this morning with an M8 Partner Symposium session, of which Professor Steve Wessling was a key participant, along with Professor Annette Goethers-Kiesling. She's the Dean of the Medical Faculty here at the Charité. Now, following on from that, Professor Steve Wessling went to a media conference, the final conference for the summit, and amongst the other people on the panel there were Jorge Sampaio, who is the former President of Portugal and currently a United Nations Special Envoy. And also there was Karl-Max Einhobel, who is the CEO of the Charité here in Berlin. Let's see what happened at that.
Are there any results or examples which are important for you to implement here in Berlin as examples for bettering our health systems here?
So for Monash and for Australia, I think this is a very, very exciting alliance, and it is an alliance that brings together partners from all over the world, from Australia, Japan, the United States, Europe, China, and I think it really is a unique alliance, and it's a unique meeting. It's a meeting where we bring together public health scientists, bioscientists, business, politicians, advocates, activists, and actually talk about health at a level that I haven't experienced at any other meeting, and talk about the solutions again at a level that I haven't experienced at other meetings, levels that include the Global Fund, include Gavi, etc., and include politicians from both the North and the South. And some of the very exciting sessions we had yesterday were where the South was actually asking or telling us what was happening, asking us for advice, but also indicating that they could also provide solutions that the North hadn't thought of. So I see this meeting gaining momentum. I think this meeting was better than last year's, and I think next year's meeting, which we've decided will be in Berlin again, will be even more exciting. And exciting for me and Monash University in Australia is the planning meeting, which occurs in March. And to me, as a dean, it's very exciting to sit around the table with deans from 8 other universities from around the world. Will be conducted in Melbourne. So we'll be hosting that planning meeting, and Melbourne's very excited, as is our Governor, David de Krester, who is here and has indicated his total support for that meeting. So going forward, I'm both excited and honoured to be the incoming president. Excited that Australia and Monash University is playing a particular role, but I really do think this meeting will have a major impact on global health. But in relation to the last question, I think it also has an impact on each of the individuals. And so upstairs, the meeting reason I was late, we were talking about academic health science centres, how you integrate clinical care with research and workforce development. And the Dean from Charité was there, and there was a lot of interchange of ideas about how that should happen in Berlin, how it should happen in Melbourne, how it's happening in Hopkins, how it's happening in Mexico and India. So I think the learnings are enormous, really, and at a very strategic level, a very exciting level. Thanks, James.
One of the words that you use, and I think we all picked up on it, was individuals. As much as we talk about the world and health, we're ostensibly here to talk about people. One of the phrases that's being used time and time again at this conference is human rights, and while it's a word that's often bandied about, what does human rights mean to you?
Thanks, James. So I think in regard to the conference and the level of discussion that we've had, I think it's the acknowledgement that, one, that health is a human right, and that we are talking about serious implications on the delivery of health. And so, for instance, one of the statements that really caught me was that the finance ministers are actually the health ministers. Health is going to have such an enormous impact on the world. It already absorbs 10% of the gross domestic product of the globe. obesity, non-communicable diseases, the ongoing challenges of HIV/AIDS, TB and malaria are just so important in the governance, and therefore the impact of those conditions on people's rights and their human rights. And so without health, I don't think we can have a serious conversation about human rights, really. So that's what it means to me, James.
Thank you very much, Steve.
Now, this afternoon we had one of the really special events here at the World Health Summit. This was the joint symposium session between Monash University and Johns Hopkins University of the United States on Indigenous people's health. And we had stepping up to the plate for Monash, Associate Professor Marlene Drysdale and Greg Phillips, who's the Special Advisor to the Dean on Indigenous Affairs. Now, back out here on the Louisenstrasse, I can tell you there is some exciting news that has come out of this week's M8 Alliance Partner Meeting, and that is the location for the 2011 annual spring meeting for the M8 Alliance Partners. It's not going to be a spring meeting this year, it's going to be an autumnal meeting because the M8 Partner Meeting is coming to Melbourne. So exciting times ahead, and that will be hosted by Monash University and by the co-president for the World Health Summit 2011, Professor Steve Wesley. Well, that just about finishes everything up here in Berlin as the World Health Summit for 2010 draws to a close. I'd like to thank the President of the World Health Summit, Professor Dr. Detlev Ganten, and the Executive Director of the Summit, Dr. Master Ardley, for their assistance in making this possible. I'd also like to give a special thanks to Dr. Matthias Bonk and also to Micah Bildhauer, who provided us with special assistance throughout these video diaries. Thanks also to our team back in Australia. That's Gareth McGilvray on editing and post-production, Jessica Boyd, who's been keeping our website up to date, and also David Humphrey, who's been providing management back there for the multimedia team. So that's it for the World Health Summit for 2010. We're looking forward to the 2011 summit under the co-presidency of Steve Wesling with a real Australian flavour for next year. Until then, from Berlin, auf Wiedersehen and bye for now.